Dr. Moyosore Adejumo, Director of Pharmaceutical Services, the Ministry of Health, Lagos, joins us on the program. Thank you for joining us.
Thank you for having me, Millicent.
Tell us about the state of isolation centers in Lagos as at today.
The state presently has 6 isolation centers with a bed capacity of 590. The occupancy rate at the present is 380, meaning we have some extra beds that are not occupied. For the community care strategy that government seeks to establish through another policy shift and the next phase, it is believed that that capacity will go up to as much as 1,000 because we will have what we call community COVID care centers within the community. And also in the spirit of public-private partnership, the state government has accredited 3 private health facilities that will also add a bed space of 50 to that. So we're looking in the next couple of weeks to going towards 1,000
and that
across
is alongside
all the isolation centers presently that we have, the private facilities, and the COVID care centers that the state seeks to establish.
Is that alongside the home care?
Now, the home care is part of the community-based approach. So you have the home, and then you have the COVID care centers. It is not just the homes. We are very mindful that there are homes here in Lagos that do not have the luxury of space where persons can self-isolate. And for about 40.9% of homes fall under that category. And for those patients that we still want to maintain in the community, to engender and foster community ownership and partnership, those persons will be isolated in the COVID care centers within their community.
As a pharmacist, I want to get your opinion of your assessment in the number of treatment regimen for COVID-19. The word appears to have turned its back on hydroxychloroquine, chloroquine use, but then a few other people feel that it's still effective, it's close to effective in the treatment.
Thank you, Millicent. Well, the controversy is raging. Do we do hydroxychloroquine? Do we do chloroquine? Lopinavir, ritonavir? In some countries, there are other remdesivir. But with us here in Lagos State, we have commenced our clinical trials. Clinical trials on chloroquine and lopinavir, ritonavir. It's a double-blind, randomized, placebo study. We will soon add hydroxychloroquine. We're waiting for our stock on that. So at the end of the trials, we will have the results out to see what is the best way forward. Until that time, we continue to maintain the regimen that we're presently using. To use hydroxychloroquine or not to use hydroxychloroquine, it's a big question, and it varies from country to country, even within Africa. So there's no hard and fast rule or commitment by any countries. If a country has enough data and enough statistics and enough experience to say that hydroxychloroquine is not working is not effective for the COVID-19, then so be it.
But this process will take some time.
It will take some time. And until such a time, we need to maintain the treatment regimen for our COVID-19 patients in Lagos State.
Just to quickly get your thoughts, the risk of people self-medicating this period. There are a lot of people saying they're taking so many drugs, and this is to prevent contracting COVID-19. I know you've been involved in a task force with, drug usage in Lagos State. What are you finding, especially in this pandemic?
Yes, it is still the bane of our society. People self-medicate, and it is not just within this COVID-19 pandemic that we have. And government continually preaches self-medication is not the best way to go. You seek medical care in approved and established healthcare facilities. For medicines, over-the-counter medicines, you can approach your pharmacist. Usually, in most cases, 60% of persons seeking care go to the community pharmacist. But the community pharmacist knows well enough to refer to the next level of care when the patient is not being able to handle by the community pharmacist. So we actually preach emphatically no self-medication. We've heard a lot about different concoctions, people coming up with concoctions of ginger and turmeric and garlic and vitamin C and all that. What is most important is that the public adheres to the social and public health guidelines, the precautions, using your face mask when you're in the public or amongst the crowd, hand washing with soap and water preferably, in the absence of soap and water, alcohol-based hand sanitizers, at least 70%, social or physical distancing, depending on who you're talking. All those precautionary measures, are also very important. They go a long way. The using of face masks has been known to at least achieve 60% of prevention of the COVID.
We'd like to appreciate your time, Dr. Moyesere Adejumo, Director of Pharmaceutical Services, Ministry of Health, Lagos State. Thank you for talking to us.
Thank you. It's a pleasure being here. Thank you.